Welcome to Farm Here Daily, a Field Forward podcast. I'm David Geiger, your host. Today on Farm Here Daily, a look at the shortage of veterinarians in rural America with Dr. Stephanie Mercier with the Farm Journal Foundation. She's working on solutions for that problem. Please be sure to like and follow the podcast as well as our social media at Field Forward Pod. We would love to have you join our community, keeping folks informed about what is affecting our farmers. This is Farm Here Daily. And joining me on Farm Here Daily, we have Dr. Stephanie Mercier. She is the Senior Policy Advisor for Farm Journal Foundation. Dr. Stephanie, thank you so much for your time today. And we're going to go over some veterinary problems that are going on outside in our rural communities. And that is not having enough veterinarians. First off, can you just lay out the situation? What does rural America face right now?
All right, so right now there's a serious shortage of veterinarians, especially brand new vet graduates from veterinary colleges who are willing to locate and stay in rural areas in order to practice veterinary medicine for the local farmers. What's known in the profession is large animal vets. We know that in recent years, only about 4% of all the new grads coming out of veterinary colleges across the United States end up in rural areas. And that pool of new vet grads is simply not big enough to replace those older vets who are retiring or passing away. And so there's a significant number of areas in the U.S., rural areas, who simply don't have enough veterinary services available to them. They're called shortage counties, I guess is one way to describe them.
What are some of the underlying factors? Why are we seeing this shortage go across rural America?
Well, I think one of the big driving factors is financial. We have data that indicates that young veterinarians who leave graduate school often have a substantial debt from the cost of that education. As of at least 3 or 4 years ago, and I don't know if there's an updated figure, on average, those vet school grads who came out with debt had a debt of about $188,000. And that's just for the vet school debt. That's not any debt from an undergraduate education that they undoubtedly had as well, but that's not included in that calculation. And we also know that at least the perception is, and probably the reality as well, is that those young vets can make more money joining or setting up what they call companion animal practice in an urban or suburban area, taking care of cats and dogs and other household pets, typically more lucrative than a job working in a rural area, taking care of hogs and cattle and dairy cows and things like that. And so that's certainly the motivating factor there. We also know that an increasing number of vet school grads are not from rural areas; they're from urban areas, and so it's not seen as going home for them because they're from cities, towns, and cities, and not from rural areas. So that's another factor as well, I think.
Just as a reminder, what type of schooling goes into veterinary practice? You said $160,000 seems to be about the average for just veterinary debt. What is that process look like? Is it as intensive as something like, because that almost sounds like a medical doctor
it's
level.
Very similar. So just like a medical doctor, young people who graduate from veterinary school have already done 4 years of an undergraduate education, so 4-year bachelor's degree, and then it's a very, very competitive process for them to be admitted to a veterinary school. And so we're looking at least 8 years of schooling. Unlike medical school, you don't then have
rotations
in hospitals and things like that, at least not on a formal basis. But it's still, 8 years is a lot of time and investment, and then it's costly. I mean, most of these are public universities, so schools like Iowa State University, Kansas State University, Oklahoma State University are obviously public universities, but the tuition costs of being a student in those on those programs is very expensive, and so that's why that a lot of them come out of that process with substantial debt.
Going back to what you were talking about in terms of some of the underlying issues, I can also see as there become fewer veterinary practices going on in rural America, is less mentorship and I guess leadership in a way that would allow someone to set up, especially if they're a new grad, and get out into some of those rural communities. How does someone even get started in rural America without some of those foundational aspects?
I think it's relatively unusual for a new vet to come into an area and set up a solo practice because they just don't have they don't have the equipment, they don't have the client base, they don't have familiarity with the countryside and know who the farmers are that they need to be serving. So I think a lot of them end up being as part of a larger practice. But we also know that a lot of the folks who run those larger practices are, like the farmers they serve, getting older and looking to retire and hand off responsibilities like that. And so you're right, the opportunity for mentorship for those young vets is diminishing.
So, what is being done to help support this? Because obviously, this is an important aspect of farming, making sure your animals are healthy and taken care of. And while a farmer's going to do his best to take care of his animals, they may not have the medical practices necessary to support some of them in disease and potentially even outbreaks of disease or other problems going on. What's being done to help support this?
Well, so David, there are a couple programs at the federal level that are designed to help cushion, make the transition easier for these young vets to set up in rural areas. A couple at the federal level. One is called the Veterinary Medicine Loan Repayment Program, or VMLRP. And this is a program that USDA runs that offers young vets in what are designated as shortage counties to get loan repayment forgiveness, courtesy of the federal government. Some states have a similar program, I should mention. But one of the problems with the VMLRP is, one, it doesn't have a lot of funding. We're talking about, I think, $10 or $12 million a year. And so that's a pretty small amount of funding for hundreds of vets. And I'm pretty sure that the data shows that there's a lot more applicants for that funding than can actually receive it. The other problem with the VMLRP is that, unlike counterpart programs that are available for medical doctors who set up in shortage areas, the federal government deems that loan forgiveness as being income. That means that those young vets are obligated to pay federal income tax on that. And that essentially makes the value of that program decline by a third, because a third of it automatically goes back to the federal government. And so one of the things we've been working on in Farm Journal Foundation, along with other partners, is to get Congress to create some equivalency between how medical doctors in those shortage areas are treated, get the vets treated the same way. Second small program that helps this is something called the Veterinary Services Grant, or VSG. And it's has funding available to help those young vets buy equipment, for example, x-ray machine or whatever the heck a vet needs in a rural office, to get funding for doing continuing education, which is a part of their obligations. That, again, is a very small program. We're talking about $4 or $5 million. And we'd like to see funding for both of those get increased. And that's something we've worked on advocating for at the federal level. And then there are some states who have similar programs, and we're encouraging them to increase funding for those as well. And there's a requirement, I'm not sure if it's in statute or regulation, that says that a young vet, if they're enrolled in a state level program that does this, that they can't apply for the federal funding at the same time. And I frankly don't see that there should be that restriction in place, that that debt load is so significant that those vets could use loan forgiveness at both the federal and state level if they can obtain it, and there shouldn't be a restriction against that.
This is Farm Here Daily. We'll be back with Stephanie in just a moment, but first we're going to take a look at the marketplace. And there was some green at the close for Thursday. September corn 4 3/4 cents higher, 384.5. December rising 5 3/4, 407. Soybeans in September 8.5 cents more, 974, with November rising 9 1/4, 993 3/4. Soybean meal in September $3.50 a ton in the green, $276.10. September wheat 9 3/4 more, 518 1/4. December rising 9 3/4 at $5.39. In the livestock market close for Thursday, October live cattle $2.57 a hundredweight in the green, $232.22, with December rising $2.90 at $233.62. Feeder cattle in September $5.40 a hundredweight more, $349.62, with October up $6.07 at $348.47. Lean hogs in October down $1.05 a hundredweight, $90.92, with December falling 72 cents, $83.80 a hundredweight. That is the Thursday market close. This is Farm Here Daily. In terms of policy, as you were just talking about, an advocacy, you are a policy expert, and we know naturally on the local level why it's important to have veterinarians. But why is it important at the federal or even global level to incentivize or make sure there are enough livestock veterinarians in our communities and in our rural areas?
Well, I think there are two basic reasons why it's important for the federal level. The whole Department of Agriculture, and certainly the way it's being treated in the Trump administration, is to put farmers first. And if there aren't enough vets in rural areas, then that's hampering the ability of those hog and cattle producers to optimize their income, because if they're having to chase around across 2 or 3 different counties to find a vet to come in and look at their animals, that's an increased cost, and it's use of their time that they could otherwise be using more productively. So that's costly to the vets to have to scramble to find veterinary care for the animals. And so when you aggregate all of that cost at the individual level up, you're looking at a significant loss of potentially loss of revenue across the United States. The second piece is that veterinarians in many ways are like first responders when it comes to potential outbreaks of animal disease. Like we honor and reward the policemen and firemen who are first responders from a human health and safety perspective. The vets really have that role when it comes to animal health. And if there aren't enough of them around, we may miss something. And speaking about the international level, I mean, we have as big as the shortage issue is for the United States, it's even more severe internationally, especially in developing countries. I remember very distinctly, before I came to work for Farm Journal Foundation, I was on the staff of the Senate Agriculture Committee. And I remember a conversation, and I don't quite remember how this topic came up, but at the time, and this was probably, 2005 or so. In the entire country of Liberia at that time, there were 2 veterinarians.
2?
2.
Wow.
So as bad as the problem is here, it's far worse in developing countries. And that's an area we're starting to look at, as well as how can we help address that internationally. I guess the third thing I want to mention, David, is that a lot of the recently emerging diseases that have hit humans are what we call zoonotic diseases. And that means that they had their origins from animal species. And COVID-19, which was a huge problem, not just in the United States, but around the world, is what's called a zoonotic disease, because we know that it originated from bats in China. And lots of different varieties of flu are zoonotic diseases, and there's a whole host of others. And having sufficient number of vets to address veterinary services in rural areas would be preferred when it comes to figuring out zoonotic diseases as well.
I think that's definitely a good point to make. Naturally, we don't want to overemphasize how important or how possible livestock to human diseases are. but it is something that we do keep a careful eye on and is an aspect of our biosecurity practices that we have.
Yep.
And that really is something that is first seen by that local vet.
Yeah, and the World Health Organization recently estimated that as much as 60% of the recent human diseases that have had major outbreaks were zoonotic in origin. So it's not an inconsequential issue.
I'd like to talk a moment a bit more on the history side of veterinarians and their impact on agriculture, especially modern agriculture as we know it today. Because naturally, with the rise of some of the antibiotics and some of the latest medicine, we've also been able to apply that to animals as well. Do we have a general idea of how our veterinarians and modern medical practices have helped influence the increase in production today?
Oh, definitely. I mean, the availability of veterinary care has been crucial in maintaining the productivity of our animal livestock operations, dairy operations, beef, cattle, hogs, etc. And one of the things that I didn't mention is that there's a lot of really large operations in those areas that can afford to have their own veterinarians on staff. And so those big operations do not have a problem with having access to veterinary services. But their smaller counterparts who don't have those kinds of resources are the ones that rely on the private practices in their areas. And so if we don't try to address this, that's going to create another disadvantage for the smaller operators and create a more incentive to get bigger, where you can afford to have your own vet on staff. And so, I mean, there's a lot of things that are pushing our agricultural sectors into larger and larger operations. And this is just one of them, but it is certainly a factor.
You know, I think I like to think a lot about the urban-rural divide and how that is often gapped and perceived and communicated. And this is only partially related. I don't believe these are veterinarians, but something that's really infiltrated the urban side are videos of these guys doing hoof trimming. And it's funny, I talked to one farmer and he's like, "Man, that was the job everyone hated. No one wanted to do that ever." And there's people who will literally just watch these guys make videos about trimming hooves. And that's just a healthy part of maintaining cattle health. And I think about it, I'm like, what happened centuries ago when you had a cow that had a problem with their hoof like that? It might just get infected, the cow goes lame. So it's just, you have that aspect of maintaining health, and some things that we do now that are kind of taken for granted. They're just videos that are sometimes even considered relaxing, you know?
Okay. That I was not aware of that.
You haven't seen those videos?
No, I have not. I mean, it's very clear that the advent of modern veterinary medicine has allowed farmers to have much lower mortality rates from any outbreak of illness in their farms. You know, back in the 19th or 20th century, we might have been looking at, okay, is there some sort of patent medicine that I can use here that because the symptoms are similar to what they would be for a human, without having any sort of medical basis for that kind of diagnosis. And I would suspect that the outcome was not always very good for the animal in question. So I'm quite confident in saying that veterinary medicine has helped farmers have much lower mortality rates among their animals now than, say, 50 or 100 years ago.
Dr. Stephanie, let's return to action as a way to kind of conclude our conversation here.
Yeah.
What are ways that farmers specifically can advocate for more access and more availability of veterinarians in ways of supporting? You mentioned a couple processes you all at Farm Journal are working on. Are there ways farmers can help out as well?
Yeah. So Farm Journal Foundation has a couple of programs that involve engaging directly with producers and veterinarians to try to be advocates for themselves. And so we have something called a Farmer Ambassador Program that we've had for more than 10 years now, where we bring in farmers from key states who have strong representation on committees like the House and Senate Agriculture Committee or the Appropriations Committee, and we bring them in and make sure they're up to date on our issues, and then they go talk to their members of Congress about that. More recently, since we started working on this veterinary issue, we've enrolled veterinarians to do something similar for these issues that we've been talking about, for the VMLRP, for the VSG. And they come in and they go up to talk to their members of Congress about them. So that's raised awareness on the Hill. And then just starting this year, we have actually brought in the veterinary ambassadors and the farm ambassadors from the same state to meet jointly with their members of Congress so they can present the issue from the perspective both of the producer and the veterinarians. And I've not been in those meetings because I'm working on other projects now, but I understand that those conversations have been very effective. And so these messages are much more well received when it actually comes from people in those professions and not from somebody who used to be a staffer on the Senate Ag Committee. I mean, we're in the room if we need to be asked for detailed information, but it's the farmers and the vets who are the main advocates on these issues.
Dr. Stephanie Mercier is the Senior Policy Advisor for the Farm Journal Foundation. Dr. Stephanie, thank you so much again for joining us on Farm Here Daily.
My pleasure.
Thanks again, Stephanie. This is Farm Here Daily, a Field Forward podcast. Thank you again so much for listening. Please, in order to continue to produce this type of local content, we would love to have you join our community. So follow the podcast as well as our social media channels at Field Forward Pod. You can also find me on social media at Geiger Reports, as well as WHO TV Channel 13 every weekday in their morning and noon hour programs. Again, I am your host, David Geiger, and I'll be back again tomorrow, everybody.